What's going on? It's Dr. Nessum, and in today's video, we're going to be reacting to Dr. Mike talking about the new weight loss drug craze, this drug known as Ozempic. There's actually a few other drugs that are gaining lots of popularity in weight loss. I have my opinions on these drugs and when they can be effective and helpful and what some of the drawbacks are, but we're going to blind react to Dr. Mike making a video about it, and we'll see what his take is. I'll give my opinions. Do I agree? Disagree? I'm not sure yet. Let's get into the video.
Odds are, if you've been on TikTok or Twitter as of late, you've seen this new drug Ozempic be mentioned. I've actually seen Elon Musk tweet about it. It's been covered in the New York Times. It's literally everywhere. So it's about time that we talk about the truth when it comes to Ozempic. For those who don't know, Ozempic is a medication that's been FDA approved to be used in patients who have diabetes to help control blood sugars and, as an added effect, decrease the likelihood of major cardiovascular events and have increases in weight loss. Because of this added effect of weight.
So there's actually other drugs as well. So there's Ozempic and Wegovy, which are both semaglutide, but then there's also Mounjaro, which is tirzepatide, which is an even more powerful weight loss drug and is a GLP-1 agonist as well as GIP agonist. So I'm interested to see if Dr. Mike's going to talk about that as well, because Ozempic, which was originally approved for type 2 diabetes, whereas Mounjaro is mainly targeted specifically for weight loss, and now Ozempic is as well.
Many people started using the medication off-label for just weight loss. The pharmaceutical company decided to take the same generic medication found within Ozempic, called semaglutide, increase its dosage, and repackage it under a different brand name called Wegovy, and seek FDA approval as a weight loss medication to be used in conjunction with lifestyle changes for individuals who are either obese or overweight, but also who have one weight-related diagnosis, like hypertension, high cholesterol, etc. And after—
Exactly. So just as Dr. Mike describes, and this happens a lot in the pharma industry, as long as something is FDA approved, so they've gone through the trials, it's a lot easier to get it approved for off-label use. So you don't even necessarily need it to get FDA approved to use it as off-label use. A lot of physicians just prescribe things off-label, whether there's research supporting it or even sometimes it's just anecdotal, but usually there's good research supporting it, but it doesn't necessarily mean it's gone through FDA approval again, so they just prescribe it as off-label use. But in this case, it looks like they wanted to make sure Wegovy, which is the brand name, could get an increased dose of semaglutide, differentiate it from Ozempic, and it be targeted specifically towards weight loss.
After so many people started getting Ozempic prescribed for this off-label use for weight loss, it exploded in popularity, mostly on television and on TikTok, with people claiming that they've lost huge amounts of weight, talking about their successes. And as a result of all this publicity, there was literally a run to doctors to prescribe this medication for them off-label in order to help them with their weight loss, which unfortunately ended up creating a shortage, which puts people at risk who desperately need the medication because they have a true diagnosis of diabetes and are not using it for off-label uses. There is a huge rise of misinformation happening at this very moment that we have to fact check.
Even that statement, it's unclear if there was misinformation about, because it's unclear if there were actual diabetics who couldn't get their medications. There does seem to be a shortage that took place, and that was for, I know a lot of people that were trying to get it for weight loss purposes, but I don't know if people that were diabetics using this medication for a long period of time actually were not able to get their meds. And if that's the case, let me know if you're a diabetic in the comments below if that happened to you.
This claim is patently untrue, and anyone saying this has a terrible understanding of how Ozempic semaglutide actually works. This medicine actually works as an appetite suppressant that slows or delays gastric emptying, therefore you feel full and you have less of an appetite. So it's more of an appetite modulator, leading you to consume less calories, therefore losing weight. Not, oh, I can eat 10 pizzas and take this medication and not absorb the calories. You see how there's a very important difference here? Because if you eat a lot of food and take this medication that slows your gastric emptying, it's gonna make you feel worse and you're gonna have more side effects, more nausea, more vomiting, more potential diarrhea and constipation. People are actually talking about these side effects who are eating their normal portions or even eating reduced portions. So imagine if you were to overeat thinking you can while taking this medication. That's a cause for concern.
Yeah, that's exactly right. That is how the drug works. It works as both an appetite suppressant and it is involved in delayed gastric emptying, so you feel more full. And so the mechanism of action is not that it lets people just eat as much as they want and then they still lose weight. The thing is, though, that's not what's actually happening. Most people that are taking this medication are not feeling the same cravings and urge to eat the full pizza, and so they're not doing it. It's an aid in diet and exercise. It's not a replacement for it.
This claim is starting to spiral out of control because it initially started with some simple observations that doctors made of their patients who were losing weight on Ozempic or Wegovy, and they were seeing that those patients were losing body fat, but they were also losing lean muscle mass. This is not surprising because the way these medications work is by suppressing appetite, therefore having the patient consume less calories. Anytime you're going to be consuming less calories, you will both lose muscle mass and body fat. This is obviously not ideal, but with this type of medication, that control is limited. But we do have control. Any good doctor should not be just prescribing this medication and forgetting about the patient. You're supposed to be getting the medication and having the doses slowly increase based on the effects and side effects that we're seeing. Also, it should come with a plan for nutrition, possibly meeting with a nutritionist who can help guide you as to how much protein you should be taking in, despite the fact that you're consuming less calories, and a plan for exercise that includes resistance and weight training to help keep on some of that lean muscle mass.
Yeah, these are all great points by Dr. Mike. So if you're taking Ozempic or Wegovy or Mounjaro, you should also be focusing on your diet, exercising, and if you do resistance training and lift weights, even if it's not a lot of weight and have sufficient protein intake, you're likely going to preserve most of your muscle mass. You're definitely going to lose some lean muscle if you're in a caloric deficit, which is the whole point of taking these drugs, is to make it easier to be in a caloric deficit and lose weight. But with any diet or form of weight loss, you're going to have some loss of lean muscle mass. So it's not necessarily proven right now in the literature that you are losing an extra amount in lean muscle mass than you otherwise would have if you're losing the same amount of weight, but through other mechanisms like just diet and exercise. And the thing is, a lot of people most likely that are on these medications, this is more just speculation, I'm interested to see if there's literature supporting this, are not the ones that are doing a lot of resistance training to begin with. So they're probably working on diet, maybe they're going for walks, but it's probably a lesser cohort of people who are doing lots of resistance training, bench pressing, doing deadlifts, lifting weights, even just bicep curls, whatever it may be. So that needs to be a focus of people that are taking this medication. And I don't think it needs to be significantly high level training. If you were going from doing no resistance training to just a little bit, twice a week, something like that, you're losing weight, but you have sufficient protein intake, you shouldn't be losing a harmful amount of lean muscle mass, and the overall health benefits of losing a significant amount of weight if you're obese will far outweigh any slight reduced muscle mass that you may be losing.
This is the one where I'm seeing the most examples of on TikTok. Someone saying, oh, I took Ozempic for a wedding and I lost 10 pounds. Look how great I look. This is not what the medicine was intended for. In fact, people who are already of a healthy weight looking to get skinnier were not the ones that were studied when we were checking the safety and effectiveness of this medication. So maybe taking it while you're already at a healthy weight can lead to worse side effects. And the worst part of all of it, once you stop taking it, the weight will come right back. This type of yo-yo dieting has been associated with numerous health risks, including returning to your normal weight and then going past it and gaining even more weight after you stop a medication like this.
I don't think the literature shows that the majority of people who stop will gain more weight than they originally started with. I think there's good literature to show that there's definitely going to be regaining of a good portion of that weight. A lot of people will not regain all the weight, and some people will be able to keep off most of the weight. But it is a medication that is supposed to be used long term for people that are very susceptible to an obesogenic environment and have a really hard time with these types of cravings and have done many diets, lost weight, gained it back, lost weight, gained it back. Obesity is a chronic disease. And so these people who start taking these medications, if it's working, you can lower down to a maintenance dose, but the goal is not to completely stop it. Some people can come off it completely and will, again, keep some of that weight off. But if you were struggling with obesity your entire life and this medicine has been effective for you, it's probably best to wean down to a maintenance dose and stay there as long as you're not experiencing significant side effects.
Anytime you have a rapid type of weight loss, what can happen is you lose the subcutaneous fat that's present in your skin, especially if in your 30s or 40s. And as a result, you can develop this hollowed out appearance to your face. Now, if you're taking Ozempic or Wegovy the correct way, this shouldn't be happening. My suspicion is the people who are experiencing this quote unquote Ozempic face or this hollowed out look are individuals who are rushing to lose weight, using it in a way that is not being prescribed to them, because when doctors prescribe these medicines, they do it with a titration mindset, meaning they start low and they slowly increase your dose while monitoring how much weight you're losing, how many side effects you're experiencing. Ideally, what doctors are looking for is for a continued 1 to 2 pound weight loss per week. Obviously, that varies depending on your own individual situation, but certainly not the 10, 15 pounds in 1 week that people are claiming they've lost on these medications when they're using them in a non-prescribed, uncontrolled way.
Yeah, those are all good points by Dr. Mike. I don't think you need to, if you're going to start these medications, worry about Ozempic face unless you are crash dieting, which you shouldn't be doing to begin with, because then you definitely will lose significant muscle mass if you're losing 10, 15 pounds in a week in an unhealthy manner. So if you're losing about 1 to 2 pounds a week and these medications are being used as an aid, you're not going to get that hollowed out look, at least for most people.
I don't think GLP-1 medication should be first-line treatments for those who need to lose weight. Anytime you're prescribing a medication, there needs to be a risk-benefit ratio done for the individual sitting in front of you, and ultimately the individual needs to decide if the medication is right for them. And while these medications have shown promise for individuals to lose 10 to 20% of their weight if they are overweight or obese, it's still important to factor in that there are legitimate risks to taking these medications. There are side effects. People have GI issues, nausea, vomiting, diarrhea, constipation, pancreatitis, kidney issues. There is a potential issue of increases in thyroid cancer long-term with these medications. And these are not reasons to not take the medicine. These are reasons to think about this medicine as a tool in our arsenal to help patients reach their desired weight. And when we talk about their desired weight, that talks about a healthy weight. To me, I feel like this whole conversation has caused us to lose sight of the big picture. With the exception of an individual who's facing harsh socioeconomic standing, someone who has a legitimate medical condition like diabetes or a thyroid condition, among the many others that cause increased weight, weight loss or weight gain is under our control. There are things that we can do, and I could recommend as a doctor to help someone lose weight when it comes to a nutrition standpoint, a fitness standpoint, sleep, mental health, etc. When I think about my patient's health, I don't just think about their weight. Weight is not the sole determinant of one's health. And when it comes to improving someone's lifestyle, we're not only lowering the weight, we're also improving their quality of life, decreasing risks of certain cancers, other diseases, and ultimately extending and prolonging their lives. That's what being a doctor is about, not just focusing on the scale.
I agree with almost everything Dr. Mike said in that ending sequence. The thing is, he said that weight loss is within your control, which I agree. For like the majority of people, you can very likely take steps to lose weight that do not involve this medication. I mean, anyone can, right? If someone was put in a situation where they just didn't have that food, they would lose weight, even if they really struggled to lose weight. Even if you had hypothyroidism, you would lose weight if you were in a calorie deficit. However, we live in a very obesogenic environment. There's hyperdense caloric foods. It's very hard for a lot of people, especially those that are obese and morbidly obese, to avoid those cravings. And a lot of people can do it, but for those that struggled for years and years and years, their entire life, the odds are just stacked against them. And so using medications like these can be a good alternative, of course, with still good diet and exercise and all the other factors Dr. Mike talks about. Mental health could play a big part of it. Your sleep quality can play a big part. And so I think as physicians, we need to look at the patient and many aspects of their lives. The problem is now there's just clinics that will pump out these weight loss drugs to literally anyone. And that's where you see some of the bad side effects if people are starting at higher medications than they should. I agree that they should be titrated up slowly so that you can monitor the side effects, and it should be individual to that specific patient. But it's a good tool in the toolkit for physicians, for people that are really struggling. I think there's going to be a place for these medications for the long term, and there's still more literature that needs to be looked at in regards to losing lean muscle mass. Certain side effects I don't think are fleshed out well enough. For example, is there actually an increased risk of thyroid cancer? Also, the pancreatitis risks are not very clear. Mainly, it seems like nausea, constipation, diarrhea are the worst side effects that most people will experience, some much worse than others. And usually that could be well managed with good titration. So overall, I think this was a good video. Dr. Mike has a large reach, so it's very helpful for him to clear up misinformation. These are my thoughts. I think I agree with most of what Dr. Mike says in the video, disagree with some of it, but that is the point of good, healthy, scientific reasoning and medical education online. People are not going to always agree, but for the most part, I think Dr. Mike nails it here, and I hope you were able to take something away from this video. If you've enjoyed, would love for you to subscribe, comment below any questions you might have on these medications or anything else you'd like me to cover, and I'll see you in the next video.